Hello and welcome to Vital Space with Dr. Raquelina Luna. I'm Edward Morgan. Hi. Hi, Dr. Luna.
Hi.
How are you?
Good.
Good. We're going to start with a quote, which I'm going to read here from my phone because I have the book in front of me, but this is the Spanish edition. Here's the quote. Every illness is sacred because it refers us to ourselves. It invites us to understand why we've created it and to look at the inner truth we've avoided. It gives us a map we didn't have. I find that pretty deep, pretty profound, and pretty revolutionary in terms of thinking that A, that we create all of our illnesses or diseases on some level, and B, that the illness itself is a kind of a gift or an opportunity. You mentioned this before when we talked about the 5 R's, the revitalize and resignify as one of the steps of your method. But I want to specifically address this with regard to your own journey with cancer, because I know this is how you responded to your cancer diagnosis. And so I want you to take us back to 2016 in November and talk about your journey with cancer.
Well, I think everybody who have a diagnosis of cancer is a shock. And I also have it. I don't want to start with the good part. I want to start saying that it's hard, it's move a lot of emotions, it's sad, it's careful, it's scaring, and I had all of that too. Mm-hmm. And like a human being, when you have that, in my case, the type of cancer is a low percent of thyroid cancer, like 2 or 3%.
Medullary thyroid cancer?
Medullary thyroid cancer, that is described in the medical literature like very aggressive. Mm-hmm. And I also, at that moment, have metastasized to nodules in my neck. Then all these words, metastasize, nodules, aggressive, cancer per se is already a strong word. Well, I was deep in emotions and that, but like I already have everything, and I believe I have my resources. The resources rescue me. Mm-hmm. Because you build something, you build a power inside of you, and suddenly when you need it, that comes. And that, I think that rescued me. Something in myself said, like some days after, okay, now it's time to do something, and now it's time that you see what you create and use it.
And these are the resources?
These are the resources, and also this is the method.
Okay.
And in my case, I start a little resignifying, but also I was already working in the other parts, because I had little like suspicious that I was of the diagnosis. I was not really clear because it was very awkward, especially the image, CT scan and all of that I received, the sonograms and everything, and they were not showing exactly what I was there, and the biopsy also was not really clear, the first one. Then I had that notion that could be, but maybe not, but I was doing already. And if I had a good diet, I was doing more, and I did a big detox of 40 days, even before the diagnosis. Then, when I learned about that...
So you kind of felt it coming on some level?
In some levels, yes. And I was saying anything that my body is showing me something, and it's saying you have to be aware, because if you have nodules also, this is your defense area. They belong to your immune system too. Then they were telling me, watch out, take care of yourself, you have alarms, this is alarms. Any person who have nodules is saying something is going on in the system. Then I know that in the immunological system also could be an infection, because at the beginning was like inflammatory, but then I say my body is acting and I am listening, and I start doing something. I didn't wait to have a result. I didn't wait to have a diagnosis. Then when I finally had it, was about be stronger in what I was doing, keep the path, but also find, oh wow, this is another message here. This is something I need to see deeper. It's not that because, and that gives the idea, and I want to say to people that everything is in movement, life is in movement. Then even if I know myself and in some point, some level, in one moment of my life, when something comes to me, it's showing me you need to learn something more. And we never stop learning and seeing and going deeper. This is an spiral of learning. Life is that.
Spiral, yes.
Spiral, thank you. A spiral of learnings, and then I had the opportunity to see in myself that. Then I start digging inside of me about emotions, about what else was there that was hidden that I was not able to see. I look for help with other colleagues, and also I enter in a state of mind where I was like in a cocoon. I was like a butterfly that is in the first stage in this darkness, but just checking myself, not the darkness in the good sense, that go deep inside in silence and try to find what was going on inside of me.
So you had the diagnosis,
yes.
And the doctors at the hospital were recommending a surgery.
Yes.
And you chose to go forward with the surgery. You needed to take out the thyroid and find out how much it had metastasized and remove the nodules. But then at the same time as accepting that route, the sort of the Western medicine route, you're talking about the other things that you did.
Exactly, because like we talked, I am integrative. I took the best of each, and why not to do the surgery when that can fit my movement and my health, but we're not forgetting the other part that is talking about causes, and is talking about, because to me to have a cancer was a process. Then how can I approach that in the whole part of me? We were talking about mental, spiritual, emotions, body. Then I was, okay, let's do with everything together. And the good part was that somebody could say, oh, I have to wait 36 days to have a surgery after a diagnosis of something that is fast and aggressive. And I say, no, I have the luck that I have those days to prepare myself. Then I start preparing myself. Then I start very focused in diet, I did other treatments of integrative medicine, of complementary medicine, like vitamin C, high dose IVs. I did acupuncture, of course. I have my colleague, one of my colleagues that was doing that for me, and I was doing also ozone therapy, and I was doing shots of and homeopathic substance that is by injections, that is also helps to reduce the tumors, and also help to balance the immune system.
And what about diet?
I start by that diet. I start with that. I was already well. I did even deeper, more raw food, even more strict in the organic, even more strict in the plants and things that can boost my energy and boost my cells, and and prepare the land. It's like I am preparing to plant seeds, then you
preparing the ground.
Yeah. This is the difference to have a good harvest or not. Then this is the same metaphor that we can use in the body, and I was doing that.
You've had a lot of cancer patients over the years, and you've worked a lot. If they were having surgery or radiation or chemotherapy, I know either with preparing them for it so their immune system was stronger, or in recovery afterwards. And so
or together. So sometimes some of the therapies, not all, we can do it at the same time. For example, a patient that is having chemo or radiation with acupuncture is awesome. How they can minimize the reactions and minimize the bad part, the bad side, the bad reactions, or also maintain better energy in the body, etc. There are many that you can maintain. Others that we don't recommend to not to compete or make react the other or stop the effect of the other.
Okay, so these are the physical. We're talking about all the physical things. You began to talk a little bit about the emotional or psychological aspect of your treatment at that time. The cocoon you talked about.
Yes.
And this is what gets back to the quote that I started with the notion that the illness is a map, or the illness is a gift, or the illness is sacred. What is it that you learned, or what is it that you dug for and found that could re-signify what your cancer was for you?
Well, I found many things. Many are private, so that I can share.
Okay.
Yeah, and also I especially that was in every level. I had a call in the physical. I have a call.
Right.
Like wash out the leg. I have other predisposition in my family system that also helps to maintain this balance in my diet and be very this is. But also I see in the emotional part so many things that I was holding, burdens and stuff, and was a good opportunity to let go many things in the emotional. And I also was able to find the moment maybe or the specific situation that triggers the cancer, because after the surgery and after visiting my endocrinologist, the one that is following me now in Mount Sinai in New York, we had a good session of more than 1 hour, just checking all the files I have with the monitoring of a nodule that I have for more than 30 years. Then
you had sonogram or imaging for more than 30 years.
Yeah, and the conclusion of her was that I already had the cancer 30 years ago.
Wow.
Then something maintains that.
But it's very aggressive.
Yeah, but in me it was like that. I'm lucky. I don't know. There is a gift there. There is another message I found. When you have a good style of life, you can stop, and you don't necessarily you develop the illness that was there. But I found which moment, what energy, what emotion triggered that, because what's an emotion?
So you jumped in a sense to things that were in part causal on various levels.
Exactly.
So let's jump ahead then to after the surgery, the notion of your recovery and how your treatment or your approach to disease changed that, or the results after the surgery.
Yeah, the results were really great. Thank God I'm here. I can tell the story, and this is the gift, one of the big gifts, the most important, I think, because I'm alive. And the seventh day after my surgery, we had the visit. I had the visit with my doctor, the surgeon, and he told me the results of the biopsy. He removed 35 nodules, and 6 were positive for cancer, and he said are only cells. Then the tumors that they saw before, the nodules that were bigger, were reduced in size. Then they were only cells, not big tumors.
So they had been reducing through what you were doing before the surgery.
Exactly, they were reduced. And also the calcitonin that usually start going down, that is one of the markers. Yeah, and also the CEA. They start reduced, especially calcitonin, after 2 months.
Usually they take 2 months
or more to start
to go back to sort of a normal level.
At the normal level that I can have having a cancer,
right?
Because it's different. But the levels were normal in 7
days.
Yes, because he took a sample of my blood the same day I was in his office, and then he called me from his office some days later, and he said.
So in 7 days you did what's normally 2 months. So this was unusual for them?
Yeah, very unusual. And my case went all over Mount Sinai, discussions of doctors because they couldn't believe not only my results, also that I had the cancer 30 years. And yes, I did all the permissions, of course, why not, to study myself, and if I can be useful for that they learn and that help others, of course, yes. And also, if I was saying to my doctor before the surgery, I am doing ozone, I am doing IVs, I'm doing that, and he was, well, I don't know about that, but if you want, keep doing it. He was very skeptic, at the same time respectful.
Right.
But he didn't enter there.
Right.
Then he said at the end, keep doing what you're doing, because he saw the results. He can't say anything about what I was doing.
Right.
But you know, apart, I know that many people maybe is listening to us and say, okay, I can do ozone. I can afford
access,
I don't have
or
access.
resources.
I don't have a place close that can help me with that, or I don't have vitamin. I think essentially 3 things. Change your diet, and you can look, research. Even also, I have in the book I mention a lot about that. But also, there are many people who have been working with diet and anti-cancer diet, and reduce sugar, reduce every product that is over manipulated, that is industrialized, and go to the real food.
Okay, change your diet is 1. Number 2?
Exercise.
Exercise.
Exercise. Move yourself.
Uh-huh.
Look the way.
You kept up exercising the month before your surgery?
I was exercising all the time.
Okay.
The month before the surgery, I reduced the intensity to not to do strenuous, but I keep doing exercises.
Some. Yeah.
So I was walking, I was doing yoga, I was doing stretching, I was doing all of that.
Okay.
And also, I was resting more.
So that's number 3, rest.
Resting, because we create the place, the space, the platform. Thank you. The platform that the cells can recover themselves. The reparations, the reparation of the cells happen in the resting time. When you sleep well, when you go deep, when you create that parasympathetic system of your body, of your nervous system, start racing and start being the protagonist.
And it prepares them in a way that it can't at any other time.
No, because if you are under stress, if you are with the adrenaline, if you are too tired, they don't have the possibility to repair. Then rest, then eat well, and do exercise, pray, meditate, connect with yourself, find a way in your way, find your way.
Yeah.
And connect with yourself. And if you have the option to call, make a phone call to somebody who can help you in this field, if you can go to one of many other doctors that do things that I do, do it. But if you can't, do that 3 things, and I will be different to approach, even to go to a surgery, even to go to chemotherapy, I was lucky, I didn't have to do more than that, because with everything I did before, give the results we were expecting. But there are many people who have to go through other therapies, and if this is the life, the possibilities of keep being alive, go for it.
Yeah.
But do more. Don't just stay in what the doctor can provide you.
This is a fantastic story and wonderful advice. Thank you, Dr. Luna, and thank you.
Thank you.